All right, so welcome everyone. We have a great crowd for today's Faculty Academic Staff Forum. My name is Erica Benson. I'm the Director of the Office of Research and Sponsored Programs, and I have the great honor of introducing today's speaker. So Dr. Leah Olson McBride is a professor in the Department of Social Work and an Associate Dean in the College of Education and Human Sciences. And Leah reached out to me, I think it was in the summer, and said, I have a project I am so excited about, and I would like to do the faculty forum. So I'm going to just throw this out there to any of you. If you have a project that you are very excited about and would like to share with the rest of us, please do that. So before I turn things over to Leah, I just want to mention that we will have time for questions and discussions after the talk. And for our online viewers, we encourage you to ask questions using the Q&A function at the bottom of your screen. And our wonderful graduate assistant, Matt, will read those out to us. And Leah, I just want to let you know, if we do have any questions from the audience, if you could repeat just a short form, that would be fantastic. Yep. Because that'll make sure that our online viewers are able to follow along. So please join me in giving a warm welcome to Dr. Leah Olson McBride.
Thanks, Erica. So anyone who knows me, which is a lot of people in this room, know that the level of excitement I have to have about something to voluntarily speak in front of large groups has to be awfully high. And with this particular project, it was energizing to do it. But I want to start with a few caveats here. So even though I was really excited with kind of the evolution and the learning that occurred as a result of this project, it is not methodologically rigorous. The sample is incredibly small. I would view it more as a pilot study, and there was a lot of adaptation that occurred from what I thought we were going to do until what we ended up doing. The other thing I want to add is I don't actually have any background in research with on-house populations. I have absolutely zero background in looking at things from an economic perspective. What happened is an employee who is charged with centralized intake for on-house people in Eau Claire happens to be from the very small town that I'm from. And she happened to be on a softball team that I coached when she was little. And when she reached out, I was like, sure, despite having no expertise in this and maybe not sufficient time to dedicate to it. So it's definitely stepping a foot in something that I don't have a lot of deep knowledge in. And so I'm going to just start talking, and I'll maybe provide some commentary along the way as to changes and things that occurred. So first off, James Massey, Charles Price, they were the student research assistants on this project. They met with the respondents to obtain informed consent. They hung out at Sojourner to catch people coming in the morning and to leaving in the evening to see if they'd be willing to participate in this project. The person in the phenomenal shirt is a graduate student at UW-Madison in the MSW program right now. And Charles in the suit coat is graduating in May from the BSW program and has secured an internship up in Jamie's neck of the woods with the Lake Holcomb School District. And so they both got to present at NCUR in California this past year. And so that's them looking all fancy at NCUR. And so we were really trying to look at is what Eau Claire is currently doing that has a lot of strengths, but I wouldn't say is a highly coordinated response to meeting the needs of on-house people. Trying to think about what does that cost the community? Versus if we switched it up and moved to a true housing first model, and again, I'll explain what I mean by housing first model, would there be a difference in economic outcomes at the community level? So that was really kind of the question that guided this work. So I'm going to start with a little bit of flawed data on who the unhoused in Eau Claire County are. So the federal government, state agencies who work with unhoused populations utilize something called the point in time count. Social work folks in here are familiar with what the point in time count is, but it's the group of volunteers, which could be all of you in the January point in time count, if you would like, go out and just look for unhoused people, right? So in July, they go out at 11 p.m. at night and then end when they're done. And in January, they go out at 11 o'clock at night and they end when they're done. And so anyone that they're able to talk with is formally counted as unhoused, okay? There are also, I saw in some of the notes around this data, because these two slides are directly from the point in time information on the website of Western Dairyland. There were additional 26 people. They didn't specify what county because Western Dairyland does a 3-county catchment area with this, who they saw and assumed were unhoused. But the individuals did not choose to engage with the volunteers or the staff who are out there, right? So if we think this through, this is a gross underestimation of the number of unhoused people in Eau Claire County alone, right? And then it depends on the strictness of the definition as to who's unhoused or not. There's a federal definition that Western Dairyland needs to use, which is a bit narrower than maybe the definitions that we in the room would use. So, you know, we're operating with theoretically thinking in Eau Claire County, there's 82 unsheltered people. That is incorrect, okay? But that is a little bit of how we get funded, right? Based on the proportion of unhoused people in the community. So I will stop talking about that, but I want to add one more piece of data around the population in the Eau Claire County Jail that identify as unhoused. So if any of you are interested, all jail data is publicly available. You can look at the jail roster and you can look at some Power BI dashboards that they've made looking kind of at demographics of individuals in the jail. And so across 2023, on average, about 241 individuals, unique individuals who were booked into the jail indicated they were unhoused. And then that number increases. One could hypothesize that when it gets colder, that increases. And so as of yesterday, there were 44 individuals, approximately 20% of folks in the jail who indicate that they're unhoused. And so you could also think about, so we pull that sample out of the point in time count because they're not out on, you know, in the woods camping during this. So just a little bit of context as to what the official numbers look like versus what we all know to be true is much higher. So briefly, the current approach in Eau Claire County, this is a gross oversimplification. It would have got, my smart art would have been just bonkers had I included everything. So we have Sojo open from 7 p.m. to 8 a.m. They have 53 beds. They generally, even this past summer, had to turn people away. That's why you see all those folks hanging out down by the Graham Street YMCA, right? They're waiting so they can get a bed when Sojo opens, okay? If temperature goes below 15 degrees, then they open overflow. And so, you know, if it gets cold enough, they can serve more than 53 people. They have Haven House, which is by where the old Just Local Foods used to be, pawn shop rental there. And they don't have a capacity, but really it's during the day you can go and sit there. You can't technically sleep there because it's not a dwelling place, but you can go there, have hospitality, climate control, that sort of thing. Community table, y'all are familiar with that. Feed My People is an option, but keep in mind, if any of you have volunteered like at a Feed My People pop-up, you generally need transportation because it's not like they give you like a couple granola bars, right? They give you a ton of food, but you probably have to have a car, somewhere to store that, that kind of thing. Chippewa Valley Street Ministry, one of our amazing alums, Karen Peterson, is a volunteer with Chippewa Valley Street Ministry. They're out by Sojourner 2 nights a week for a couple hours, providing handouts and stuff like that. And then there's this thing that I actually didn't know there was until I started on this project, that there is actually a centralized database of people who meet the qualifications of unhoused, that Western Dairyland. So I say kid, but she's an adult now. The kid I coached in softball, part of her job is that the intake. I don't understand why we wouldn't use that number instead of the point in town number, but yeah. So these are kind of what we do currently. Some literature I read that I did not write, so this is not my opinion, I'm just sharing it, would call this a patchwork or a Band-Aid approach, okay? So compared to that, we have the Housing First model. And so places who say they utilize Housing First have adopted this at sort of different levels, right? One person say we're a Housing First agency, they say you're a Housing First agency, it could be like a cucumber to an apple in terms of comparisons. But the general philosophy of Housing First is that in order to get your life together, you need to be housed, right? So we're not going to set rules around sobriety. Well, that would be ideal. We're not going to set rules around having a job, although that would be ideal. We're not going to set any rules on taking medication for behavioral health concerns, right? It's the idea that we house you and then you grow, rather than once you're grown, then we'll put you in housing. And if any of you imagine like trying to accomplish sobriety, mental health stability, and maintaining a job, transportation without housing, it's an absolute ridiculous setup that we put people in, okay? So there are places in town that say that they're Housing First. Again, variety of opinions on that. And really this is predicated on the idea that housing is a human right, okay? All right, so we're going to talk a little bit about the sample and methodology. Western Dairyland was hoping that we would talk to 20 people. So again, if we use what we could technically consider sort of the population size based on the point in time count 80 unhoused. So they asked that we talk to 20 people. We were able to speak with 16 people before we needed to stop because James and Charles needed to work on their poster for Enter. And so we met with these folks when they were checking in and out of Sojo, and one person, I believe, was banned from Sojo, which is quite common. And so we met with them at the Western Dairyland offices. The majority of individuals identified as male within the population. And so here's what we did. James and Charles obtained informed consent from the respondents. We did have the informed consent written in a way where we could get protected health information. So I'll talk a little bit about that. And then our plan was to utilize kind of a standard practice in this kind of work, which is a timeline follow back protocol. And so really that would be where I would say to Jamie, hey, let's think about the last 365 days. Can you tell me when you stayed at Sojourner or you were inpatient or any of those sorts of things? And I don't actually know how other people made it work. We tried. And then when I compared the self-report data, which again, other researchers are like, yes, gold standard, totally spot on, with the secondary data that I could like verify from Sojourner how many nights I'd been there, there was zero reliability between those two things, right? So that was one iteration in the research. Then I was like, this isn't going to work. We need to think of something else to do, right? Luckily, our consent was written in a way that then allowed us to access secondary data in addition to that self-report data that James and Charles had collected. So while we were obtaining informed consent, we asked respondents if they'd be willing to sign a release of information for Mayo, Sacred Heart, and Western Dairyland. Western Dairyland release of information got us access to the Sojourner records. We provided respondents with $20 in gift cards to thank them for their time. And then we utilized publicly available data from the jail and from CCAP, because again, the nights they were saying they were in jail, the nights they were saying that days they had were arrested, were sometimes way higher with their self-report than reality, and in some instances, significantly lower, okay? So that was sort of the big picture of data collection. This part was pretty easy. It was then the kind of quantifying what we collected afterwards, which was a bit more challenging. So I made some choices after we got that information on how to develop this variable of community level costs. And so as I reference my initial idea of utilizing the standard practice of timeline follow-back method was not going to work. And so I decided to go with sources that we could externally verify using records. Places like Community Table do not require you to sign in or anything like that to use those services. So I couldn't access that data. Other entities such as my release of information for medical services are not included in the final variable I used. I'll talk briefly about what we did learn from that, because not enough individuals were willing to sign a Mayo consent or a Sacred Heart consent, or at that time a Prevea consent, Marshfield consent. And so what I ended up doing, and this is the way I had talked about it in Jamie Tester-Morfitt's class with the students, is really saying A plus B plus C equals the variable of community level cost per respondent. And you can see then, A was nights at Sojourner. Sojourner states in their grant applications and stated to me that they use a $40 a night per person cost, right? So 50 people there. I shouldn't have done this because I'm not good at math, public math. So yeah, $40 a person, right? And then Eau Claire County Jail, the jail administrator and the Eau Claire County Sheriff were very helpful with this project, which was wonderful. They use $112 a night as the cost it takes to have one human in the jail overnight. And then I did a little bit of digging on the right secondary data source to quantify legal system involvement. What I chose to go with was data from RAND specific to Wisconsin. They do not have data specific to Eau Claire, so this could be skewed in a certain direction, right? Because we have Madison and Milwaukee and rural areas in there. But this is the number that they provided. Essentially, like every time there is a filing, this is about what it costs the system. And that's going to be court time, district attorney time, public defender time. So not jail time, but just sort of the being in the system, being processed in the system. Additional caveat here is, and you'll see more on an upcoming slide, in order to be as conservative with my estimates as possible, I chose to apply that $354 RAND data per filing rather than per charge, right? So if there were 4 charges that a person had on a given day, we counted that as 1 filing, right? So this number in the data that's coming up would be much higher had we done it by charge rather than by filing. And so we chose to exclude 2 sources of data. I had already talked some about medical expenses, a small number of respondents who chose to sign the consent, even smaller number of healthcare facilities that honored that consent and gave me the records. And then also the discrepancy between self-report data and secondary data. So A plus B plus C equals the variable we're looking at, which is community level cost per respondent. So here's some cost estimates. And I should have specified early on that I utilized the time frame of 2023, right? So January to December. And here's what we came up with. So among the 16 individuals in the sample, the range of number of nights they spent in the jail, 0 to 251. So if we go back then and we remind ourselves of the $112 a night that it would cost to be housed in the jail, we have the range, I did an average, and an average cost per respondent within the sample. Again, there were people who had no jail nights, and so, you know, it's just averages. The legal system involvement, same logic, again, went by filings rather than charges. But in general, within the sample, just over 3 filings in 2023 for folks within the sample, okay, on average. And then the nights at Sojo, same thing. The asterisk here is that there were a handful of people, I think 4, that we met at Sojourner, but they didn't have any secondary data indicating they had stayed at Sojourner, right? And so the low end self-estimates was 7 nights at Sojo. I just chose to stick with secondary data. So there's a 0 in there for those 4 people. But again, that contributes to a conservative estimate on these things. And so if we add up A plus B plus C, our variable is just over $12,000 per person with the 16 in the sample during the year 2023. And again, we didn't include all that other stuff, right? So community table, anything like that is not in there. This is just a per person look. Respondent 4, so dollars here, respondent numbers here. So 4, 9, 12, and 13, those are the people who showed as no nights in Sojo, despite us meeting with them in the morning after they had stayed at Sojourner. And so, you know, just kind of, that's our 16 people within the sample. As you can see, some relatively inexpensive service users, about $1,000. And then our folks, and I'm guessing that human 31,202 was probably one of our long stay in jail individuals. So a little bit of breakdown on the legal system data, because while I truly went into this project thinking about how to help my contact at Western Dairyland get a sense, I mean, really what she wanted to know was what services are people using and how often are they using them, right? But then when I started thinking about, I think we can quantify cost for this, I am sharing this data because it kind of supports a hypothesis I have a bit later that I'll share. But if we look at the sample of 16 people, there were 104 charges total among those 16 people, 54 filings total. And I decided to go through CCAP just line by line and look at the most commonly occurring charges. And because I was guessing that if the individuals had been housed, a lot of this may not have occurred. Again, I don't know, but I'm guessing, right? Because the camping trespass, these were heavy on camping on public property, trespass to public property, right? So if you were sleeping out back of Shift coffee house, right? That could constitute trespass to public property. So we have a fair amount of charges here. The substance use paraphernalia, there were maybe 2 felony charges in there. The rest were misdemeanor, right? Possession of paraphernalia, possession of THC, public intoxication, those sorts of things. With the disorderly, often it was coupled with when law enforcement was talking with folks about these other things, and then it escalated. And then I had to learn from everyone's favorite professor / attorney, Jamie Tester Morefoot, what bail jumping was, because I didn't know. You know, and I'm not going to ask you, Jamie, and I put notes here, right? Okay, so bail jumping is often associated with failure to appear in court, not keeping the court notified of current address, not committing a crime while a case is pending, no contact with the purported victim of a crime, maintenance of sobriety, or violating geographic restrictions like you can't leave Wisconsin and you go over to Woodbury, whatever. And so you could infer that people not showing up to court because they forgot, because they don't have a planner, right? Because they don't have transportation. It's really this cumulative effect, right? You get a charge, you don't show up for court, they add a charge. And again, most of this stuff is misdemeanors within CCAP. And then a little bit of data on the 3 folks who we were able to get their medical records from. So of those 3 respondents, they had 5 to 12 ER visits. And when I quantified costs, because I had requested the billing records, I only used ER specific costs. So medication, lab testing, if they were transferred to an inpatient, if they had an X-ray, MRI, I did not include that, right? So just maybe the folks who we could infer were using emergency rooms as a form of primary care. All right, so here's kind of where I'm definitely doing some speculation. But if we looked just at jail costs for this sample, those 16 folks had incurred about $7,500 in jail costs across the sample. If we look just at Sojo nights, just over $3,500. If we looked just at the sort of CCAP filing related expenses, excluding jail costs, were here. And then if we add up A plus B plus C, our primary variable is here, right? And so then this is where I'm bringing in my own opinion. So if it costs the community this much, plus whatever else I didn't include from all the other services and, you know, encounters that may be involved, including stuff that I can't quantify, which would be discomfort from people's behavior if they're not particularly stable and they're hanging out at Phoenix Park, right? Costs to business owners if someone chooses not to go into their establishment because folks are resting in that area. And so none of that is included in this, obviously. But if we compared this community level cost with what the Housing and Urban Development has said is fair market rent for a studio in Eau Claire, city of Eau Claire, one could speculate that it may be cheaper to house them, housing first mindset, rather than continue doing what we're doing. If we then upgraded to a 1-bedroom, slightly more costly, and again, this is what HUD says fair market rent should be. On upcoming slide, I will talk about what our rent actually is in Eau Claire. Still potentially cheaper. And I know that in most cases, human rights related arguments, moral arguments, aren't particularly effective when trying to change policy, trying to change the minds of people who allocate funds. And so if some of you in the room added the moral issue to this, even if the cost was quite similar, it still would be the right thing to do, in my opinion. So this is just a little bit of an overview of the landscape of housing in Eau Claire County, right? Because as I was doing this, I was just talking about this, and I had the opportunity to present to 2 sort of larger groups of stakeholders who have some interface with the on-house population about this. Some of the conversation there was, is this truly an issue of there is not enough housing? Or is this a matter of will, right? That we are choosing to spend our money in a way other than supporting this population and others who are at risk of housing instability. And so according to the Census Bureau, median rent in Eau Claire, just over $1,000. And there are just under 1,100 vacant units. And this is real-time data. The vacant units data is from the St. Louis Fed. And they feed that data then to the Census Bureau, right? And so that's totally up-to-date data. So we have, a fair amount of vacant units in the city of Eau Claire that we could potentially choose to utilize, right? There are, from the Eau Claire County Housing Authority, there are about 358 individuals who receive subsidies right now. The majority of those individuals are something other than a single adult who does not have a designation of having a disability, right? So a lot of these vouchers are going to families, individuals with disabilities, and individuals over the age of 55, okay? In addition, the Housing Authority, according to the county website, has about 300 additional people on that wait list, purged every 6 months. So you could imagine that that number is likely higher because of people getting tired of reapplying and reapplying, right? So, and I'll move over to here quickly before I go to my last point. The county, in conjunction with some stakeholders, published a absolutely amazing report on sort of a regional view of housing in Eau Claire County. And it looks back, decades, and then provides some projections to the future. And so this data is from that group. And so what they're saying is if we look in Eau Claire County, so this would include some outlying areas, and we looked at the number of households who have an income of under $19,999, which is still likely higher than the income of some of the folks, the majority of the folks in the sample. If you have 20,000, your affordable rent would be $500 a month. And so that probably not a lot of units that maybe aren't student housing, massive number of people in a house that you could get for under $500 a month. There were 3,500 approximately households in Eau Claire County that fit within that under $20,000 in the year 2021. There are 1,700 units that are feasibly under $500. And so then if we take the students out of this, right? So make it even more conservative because this includes students. They're saying that there is about 1,000 unit difference between what we need and what is available in our existing housing stock, the way that it is priced. And so this is my own just observation. As you know, the county has been awarded a couple cycles of ARPA funding from, recovery funding from post-COVID. And the most recent county board vote on how to use our 2024 ARPA funding, there were several things up in the air, including a request for sort of a day resource center, which would be a centralized hub for unhoused individuals. So the two requests that the county board chose to fund were a jail expansion of $1 million, and I believe that added 12 beds, will add 12 beds when it occurs. And just under $500,000 for Beaver Creek Reserve. And I think that was like to improve the septic and do other sort of updates to Beaver Creek Reserve. I don't know where the rest of the money went from the it was 1.7 where it was on the table. And I was procrastinating doing this last night. So I just gave up on tracking the rest of the money. And so just sort of a interesting choice of where we could have put this money. Definitely a lot of limitations. So they're listed up here. But despite all those limitations, I still was pretty jazzed about how this project turned out. And I'll turn it to questions, and I'll add that I have offered to some stakeholders that if they wanted to continue this project, it would be actually quite easy at this point, because really all we would need is releases, right? We don't need that timeline look back data. We just literally need the releases. So if someone wanted a human to camp out at Sojo, run people through informed consent, receive the releases, I could really quickly now pull all of that data. So we could potentially expand the sample substantially. At this point, no one has taken me up on that. Does anyone have any questions?
There was the legal bucket of money, I guess the legal system involvement. Did that include in like the police department in terms of just call volume?
So
I think it's about 20% of call volume for the police department is like related to unhoused individuals.
So the question was, did the RAND data that was used to estimate the legal system costs, did that include police time? So it did. RAND brought in calculations on police and sort of the more lawyer justice system-y type court-related costs with that. So that is included. One of the resources I did not include in my smart art of all the resources is that City of Eau Claire does have something called the HOT team, Homeless Outreach Team, which is composed of law enforcement, Eau Claire County social worker, and other employees of housing related, unhoused folk agencies. So like Western Dairyland, probably Community Table. I don't know exactly. I don't know a ton about that. But I think that probably is partially in response to that high call volume associated with the unhoused population.
Housing First actually work mechanically?
That is a question that I don't know the answer to. Yeah, if I had a good knowledge base in this, I would know more. Here's the little I do know that may be wrong. But typically housing is provided, and then case management services are provided alongside that. And so really the goal is to provide service linkage along the way and help folks with sort of building stability so they could eventually move out of sort of this supported housing model and then move to true independent housing. The reason I say that the degree to which places have adopted true housing first models are a bit tied to things like, what is the threshold for eviction, right? Because ideally you need to have a fair amount of patience from whomever the property owner is, right? And so if an entity like in Minneapolis, I don't remember, Salvation Army, I think has some huge, housing first units there. So that's probably going to have a higher level of success because of the kind of forgiveness of behaviors that may occur with when folks are unstable. But really the model, it's like, we're going to give you a period of grace. We're going to support you in that period of grace, and then you'll be hopefully on your own way down the road.
So some public entity is finding rental properties for people to.
Public or private. Yeah. So like Western Dairyland states that they have a housing first approach for, I'm so sorry I bored you two.
We have to.
I know.
Way over 8.
Bye, Jamie and Lisa. Yeah, it could be a public entity or a private entity, most likely going to be a private agency utilizing grant funding from the feds or from the state. Yep, like community development block grant kind of stuff.
It seems like one of the issues around people not wanting to use Sojourner House or those kind of places is that they're not comfortable with the
Oh, yeah, absolutely.
people who are there. So if you had housing that was spread out and not concentrated, that seems like that would perhaps be more successful.
Yeah, and you know, in Eau Claire, the Eddy over by the brewing project, and I believe the new gorgeous apartments that they're building just north of the brewing project. Well, I know that those have some units that are allocated for to be more affordable. I don't know if those are going to rely on a housing first approach, because you could imagine if you have a small number of units that are affordable, and then you have a large number of units that are market rent, market rate, there is a lot of sort of negotiation as to what does someone who can afford market rate, what are they cool with within their building? So yeah, like the city of Chicago, when they moved from true housing projects, right, the high rises to scattered site housing, they ran into a lot of issues with putting a small number of affordable units within an existing market rate building, got a lot of blowback, sort of the not in my backyard kind of thing.
Well, we've kept you past time, so thank you.
Thanks everyone for coming. And again, take it all with a grain of salt, because there's a lot of things that I don't know about this. So thanks everyone.